There's something I need to say that I've been carrying with me for a very long time. And the moment I say it out loud, I know it's going to make some people in my own profession uncomfortable, maybe even angry. But after more than 20 years practicing medicine, after watching thousands of patients do exactly what they were told and still end up worse off, I can't stay silent anymore, and here's the uncomfortable truth most people don't want to hear. Sometimes, especially after the age of 60 or 65, the worst thing you can do for your health is agree to too many medical tests. Now I can already hear the reaction. Hold on. Aren't doctors supposed to tell us to get checked for everything? Isn't early detection the whole point? Aren't we supposed to catch problems before they get serious? And yes, that's exactly what we've all been taught. Screen early. Find it fast. Stay ahead of disease. That message is everywhere. But what almost never gets talked about is what happens after a test finds something. Because here's what those glossy commercials and reassuring pamphlets don't tell you. The moment a test shows anything at all, even something harmless, a chain reaction begins. And very often, that chain reaction quietly destroys quality of life. Today, I want to walk you through 4 common medical tests that I see causing more harm than good, especially in people over 60. I'm not trying to scare you away from doctors or medicine. I'm trying to help you understand what you're actually agreeing to before you automatically say yes. But before we talk about the tests themselves, you need to understand one concept that completely changed how I practice medicine. Once you see it, you'll never look at testing the same way again. It's called the cascade effect. Here's how it usually starts. You go in for a screening test. You feel fine. You're living your life. No symptoms, no complaints. The test comes back with a finding. Maybe it's a shadow, a spot, a number that's slightly outside the normal range, something that might be completely harmless, something that may have been there for decades and would never have affected you. But now the doctor has seen it, and once it's seen, it can't be unseen. Because what if they ignore it and it turns out to be serious later? So they send you to a specialist. The specialist orders another test, a more detailed one. That test still isn't perfectly clear. So now there's talk of a biopsy or a procedure, sometimes even surgery. Each step adds risk, infection, bleeding, side effects, anxiety, weeks or months of stress, time stolen from your life. And here's the part that almost nobody tells you. When you finally reach the end of that road, 9 times out of 10, you're told the same thing. Good news, it was nothing. It was never going to hurt you. But now you've lived with fear. You've gone through procedures. Sometimes you've had complications. And you're worse off than when you started. All because of a test you got when you felt perfectly fine. That's the cascade. And it often begins with a test that never needed to happen in the first place. So let's talk about the first test I see triggering this cycle over and over again. And this one is especially seductive because it sounds advanced, intelligent, and proactive. I'm talking about whole-body scans, full-body MRIs or CT scans that promise to look at everything all at once. You've probably seen the ads. Scan yourself from head to toe. Find disease before it finds you. It sounds incredible, like taking control of your health with one simple test. And I understand the appeal. The idea of knowing everything feels empowering. But here's what actually happens. Let's say you're 65, you feel good, you're active, no symptoms. You decide to get one of these scans just to be safe. You lie in the machine for half an hour. A few days later, the report comes back, and there it is. A small lung nodule, 3 millimeters, about the size of a pencil eraser, or a cyst in the kidney, or a spot on the liver. The report calmly says, recommend follow-up imaging in 3 to 6 months. In that moment, everything changes. You walked in feeling healthy. You walked out knowing there's something inside your body being watched. Suddenly, every breath makes you think about your lungs. Every twinge makes you think about your kidney. Peace of mind is gone. 3 months later, you're back in the scanner. Maybe the finding is still there. Maybe it's slightly bigger, hard to tell. The radiologist suggests a specialist. The specialist wants to be cautious and recommends a biopsy. And a biopsy is not a small thing. It involves needles, anesthesia, bleeding risk, infection risk, all to investigate something that was never causing symptoms. Here's what the data shows. When we scan healthy people over 60, we find abnormalities in almost everyone. I'm talking about 90 to 95% of people. Little cysts, small nodules, minor irregularities. The medical term is incidental findings, things discovered by accident. The vast majority of them will never cause harm. They're simply part of having a body that's lived for 6 or 7 decades. Internal wrinkles, so to speak. But once we find them, we feel compelled to chase them. And that's where the cascade begins. Studies have followed people who underwent whole-body scans. The results are telling. They did not live longer. They did not avoid serious illness. But they did experience significantly higher levels of anxiety, depression, and unnecessary medical procedures. The scans didn't make them healthier. They made them patients. So what should you do instead? Instead of chasing images of your insides, focus on how your body actually performs in the real world. Can you climb a couple flights of stairs without stopping to catch your breath? Can you rise from a chair without pushing off with your hands? How steady is your balance? How well do you sleep at night? These functional signs tell us far more about your health than any scan ever could. If you really want a meaningful health evaluation, sit down with a physician who will actually spend time with you. Someone who reviews every medication you're taking, because I can almost guarantee at least one of them is doing more harm than good. Someone who asks about what you eat, how active you are, and whether you feel socially connected. Those everyday factors, the unglamorous ones, are what truly determine long-term health. A scan looks for problems that may never matter. A functional assessment strengthens the health you already have. That distinction is critical. Now let's move to the second test. And this one taps directly into one of the deepest fears people have as they age. I'm talking about brain MRIs for mild memory lapses. Here's how it usually plays out. You're in your mid-70s. Occasionally, you forget an actor's name. You walk into a room and momentarily forget why you went there. Completely normal things that happen to nearly everyone with age. But maybe your children are worried. They're scared, so they push you to get a brain scan just to be safe. I understand that fear, truly. No one wants to imagine losing their memory or their sense of self, but here's what most people don't realize. Ordering a brain MRI for mild forgetfulness is almost never helpful and very often harmful. Because when the report comes back, it's filled with alarming language. Mild cerebral atrophy, age-related changes, white matter lesions, small vessel disease. Those words sound terrifying. They make it feel like something is seriously wrong, but here's the reality. Those findings are completely normal for someone in their 70s. They describe what nearly every aging brain looks like. It's no different than scanning your skin and being shocked to see wrinkles and age spots. Of course they're there. The problem is the language doesn't sound normal. It sounds pathological. And suddenly, someone who was functioning just fine is walking around convinced their brain is deteriorating. Here's what the research shows. When you scan the brains of healthy adults over 75, more than 90% show abnormal findings on MRI. More than 90%. Yet the majority of those people have perfectly normal thinking and memory. I've seen patients who manage their finances, read complex books, do crossword puzzles daily, and their MRI looks terrible. I've also seen people with early dementia whose scans look relatively unremarkable. The image does not equal the person. So what should be done instead? If memory is a concern, we start with simple, practical tests right in the office. They take about 10 minutes, remembering a few words, drawing a clock, counting backward by sevens. These tests actually measure how your brain is working, not just how it looks. And if those tests show a real issue, then we look for causes because many of them are reversible. Medications are a huge one. Many common drugs cause mental fog. Vitamin B12 deficiency is another. Depression often masquerades as memory loss in older adults. Sleep apnea quietly starves the brain of oxygen at night. Thyroid problems can slow thinking dramatically. When we identify and treat these issues, memory often improves significantly. No MRI required. We're focusing on function, not fear, treating the person, not the picture. Now, if someone is clearly declining, getting lost in familiar places, unable to manage money, struggling with daily tasks, that's different. In those cases, imaging absolutely has a role. But for ordinary age-related forgetfulness, brain scans usually create anxiety without benefit. Now let's move to the third test on the list. And this one surprises people because, on the surface, it seems completely reasonable. I'm talking about routine cardiac stress tests, putting someone on a treadmill simply because they've reached a certain age. Here's the common scenario. You're 72 years old. You're scheduled for a routine surgery, maybe a knee replacement or hernia repair. Hospital policy says everyone over 70 needs a stress test beforehand. Even though you feel fine, even though you walk regularly, even though you don't have chest pain or shortness of breath. So they put you on a treadmill. But think about this logically. If you can walk a couple miles in your daily life without symptoms, what is the treadmill actually testing that your normal routine hasn't already demonstrated? Your daily life is your stress test, but protocol is protocol. Here's the issue. Stress tests have a very high false positive rate in older adults. That means the test often suggests a problem when there isn't one. Heart rate responses change with age. Medications interfere. Normal age-related changes trigger abnormal readings. And suddenly the test says something might be wrong. Once that happens, the cascade begins again. Next comes a cardiac catheterization. A tube is threaded through an artery up to the heart. It's invasive. It carries real risks. And most of the time, the result is predictable. Some plaque, some narrowing. Nothing that requires stents or surgery. Nothing that was about to cause a heart attack. But now the damage is done. The person has undergone an invasive procedure. They've been labeled a heart patient. They're placed on new medications. And perhaps worst of all, they lose confidence. Someone who was active becomes afraid to exert themselves. Tennis stops. Walking slows. Life shrinks. The test meant to protect them ends up stealing their freedom. So what's the better approach when it comes to heart health? Listen to your body. If you can climb stairs, walk at a good pace, and go about your daily activities without chest discomfort, unusual shortness of breath, or dizziness, your heart is already telling us it's doing its job. Those real-life signals matter far more than a treadmill in a clinic. The symptoms that should prompt testing are clear. Chest pressure with exertion, breathlessness that's new or worsening, lightheadedness, or unexplained fatigue. When those appear, absolutely, a stress test can be the right tool. But if the goal is prevention, there's a much smarter option. It's called a coronary calcium score. It's a quick CT scan that takes about 5 minutes. No treadmill, no needles, very low radiation. It simply measures how much hardened cholesterol, calcium, is sitting in your coronary arteries. The result is a number, A score of 0 means your risk of a heart attack in the next several years is very low. A higher score tells us it's time to take prevention seriously with lifestyle changes and, if appropriate, medication. The key difference is this: the calcium score informs. It doesn't automatically push you into invasive procedures. It gives you clarity without panic. Don't let anyone put you on a treadmill just because of your birth date. Trust what your body is already showing you every day. Now we come to the fourth and most controversial test on the list: routine colonoscopies after age 75, specifically continued screening colonoscopies when prior exams have been normal and there are no special risk factors. Let me be very clear. Colonoscopies are an excellent tool. I strongly recommend them beginning around age 45 or 50. They save lives by allowing us to remove polyps before they turn into cancer. If you're in your 50s, 60s, or early 70s and you're due, get it done. But every medical test is a balance between benefit and risk, and that balance shifts as we age. The benefit of a colonoscopy is preventing a cancer that usually takes 5 to 10 years to cause symptoms. But by the late 70s or 80s, the risks begin to outweigh that benefit for most people. The preparation alone can be dangerous. The dehydration, electrolyte shifts, and weakness that come from drinking the bowel prep solution overnight. Sedation carries greater risks of confusion and breathing problems in older adults. And the risk that concerns physicians the most is perforation, a tear in the colon wall. As we age, the colon becomes thinner and more fragile. After 75, the risk of perforation roughly doubles or triples. A perforation is a medical emergency. It often requires surgery. Sometimes it leads to a permanent colostomy. For an 80-year-old, that kind of outcome can mean the end of independent living. Now weigh that against the benefit. You're trying to prevent a cancer that would take years to become dangerous. If life expectancy is under 10 years, the math simply doesn't favor routine screening. That's why most medical guidelines now recommend stopping routine colonoscopy screening somewhere between 75 and 85, depending on the individual. This isn't one size fits all. A strong family history of colon cancer, prior high-risk polyps, or inflammatory bowel disease changes the equation. But for the average person with previously normal exams, continuing screening deep into the 80s often causes more harm than good. So what's the alternative? You don't ignore your colon, you switch to smart surveillance. First, pay close attention to symptoms: persistent changes in bowel habits, blood in the stool, unexplained weight loss, abdominal pain, anemia. If any of these appear, age no longer matters, a colonoscopy is warranted. Second, focus on diet. This is powerful and risk-free. Fiber is one of the strongest protectors of colon health. Fruits, vegetables, beans, whole grains. Fiber feeds beneficial gut bacteria that reduce inflammation and lower cancer risk. More lentils, more broccoli, more oats, more apples. That's prevention that supports your entire body without downside. So here we are. 4 tests that, in my experience, often cause more harm than benefit after age 60. Whole body scans that uncover non-problems. Brain MRIs that turn normal aging into fear. Routine stress tests that launch unnecessary procedures. And colonoscopies after 75 that carry more risk than reward. The common thread is the cascade. One test leads to another. Another leads to a procedure. A procedure leads to complications. And somewhere along the way, we forget to ask the most important question of all: is this person actually better off? After 22 years in medicine, I've learned that health is not about perfect test results. It's about function. It's about doing the things you love: walking, reading, traveling, enjoying your grandchildren. living without constant fear or unnecessary medical interference. The goal at 65, 70, or 80 isn't just to live longer. It's to live better with independence, dignity, and joy. And sometimes, the healthiest decision you can make is saying no to a test that would send you down a road you never needed to travel. I'm not saying avoid doctors. I'm saying be an informed patient. When a test is recommended, ask why. Ask what happens if it finds something. Ask about the risks. Ask whether there's an alternative. Then decide based on what truly matters to you. You are in charge of your health, not the protocols, not the computer reminders, not the guidelines. If this perspective helped you, share it with someone who might benefit. And if you want more honest conversations about health and medicine, subscribe. I'll keep having these discussions because they matter. Let me know in the comments, have you ever felt pressured into a medical test that didn't feel right? Thank you for listening. Take care of yourselves. And remember, sometimes doing nothing is the most protective choice of all.